Hello, good morning, and welcome once again to Moorgate Andrology. Now, in today's video, we're going to talk about penis enlargement surgery scar. So, when we carry out lengthening of the penis, which is a procedure called ligamentosis surgery, there is an incision at the base of the pubic area. Now, in years gone by, the incision of choice was something called a YPlasti. And a YPlasti incision, if you're looking down at your penis, looks like the letter Y. You have two cuts just either side of the very base of the penis at the natural crease that's formed, and also one incision running up. So as you're looking down, it looks like the letter Y. Hence, it's called a YPlasti. Now, this incision is still used across the world. It's not as though this incision is not used anymore. But perhaps from a cosmetic point of view, it's not the best compared to a transverse incision or a little cut across, which we'll discuss in a moment. The YPlasti incision, if you imagine the letter Y, has a junction where the three lines of the letter Y meet. And this can be a source of problems afterwards, because where the three lines meet, sometimes, not always, but sometimes the wound can open slightly, particularly if you have erections. It can open slightly and delay the healing and put you at increased risk of infection. So that's the downside of the YPlasti. The transverse incision, on the other hand, is a cut across, again, right at the base of the pubic area in the natural crease that most men have got. Cosmetically, arguably, this is a much better incision because the scar is very neatly hidden in the natural crease. In both cases, dissolvable sutures are used. So you will not need to return to have stitches out. They fall out naturally on their own in the weeks after the surgery. Now, it does take several months, up to a year in fact, for the scars to mature. So it's really important that you take good care of the scar, particularly in the first few weeks as things begin to heal. And presumably most of the time the scar is going to be covered up, but if it was ever exposed to the sun in the first 12 months, make sure that you put sunblock on the scars. Really important that you don't expose them to the sun during the healing process. I hope that's given you some idea of the incisions that are used in penile lengthening surgery. If you'd like to know more about penis enlargement surgery, please do get in touch with us here at Moorgate Andrology. We can arrange a consultation for you with one of our urologists to discuss the procedure in much greater detail. That's all from me today. I look forward to seeing you back here at Moorgate Andrology very soon. But until then, bye for now.